Okay, so I'm just arriving at the scene. Got my gloves and my safety glasses on, and I'm wearing full-length tops and pants. And I've visually assessed the area as safe. There's no danger there. So now I'll walk in. Hello, I'm Chris from the ambulance. What's your name? Tara. Tara? Okay. Can you tell me where you are, Tara?
I'm at home.
Yeah, where's home?
Home's in Meadows.
Okay, and can you tell me what day it is?
It's Tuesday.
Tuesday, excellent. Okay, now why have you called the ambulance today? What's the problem?
Well, I got home and then all of a sudden I felt funny and my left side's not working properly.
Okay, alright. And have you felt like this before?
No.
Okay. And when did this happen?
About 20 minutes ago.
20 minutes from now? Okay. And did you lose consciousness at all?
No.
No. Okay. Do you have any pain?
No.
None at all? Okay. Alright. So I'm just going to have a listen to your breathing. Okay, so I'll just ask you to breathe normally. Okay, so just in and out, breaths. Okay. Keep breathing in and out. That's it. And just check your heart as well. Okay. Any more? I'll just check your pulse as well, Tara, if I just lift up your sleeve. Okay. And also just check your blood pressure, so I'll just put this blood pressure cuff on you. And I'll just pump it up nice and strong. And we'll put these back on. So I'll just pump this up. Okay. I'm just releasing it to get the systolic and diastolic pressures. Just letting it out slowly. That's pretty good. I'll just take this cuff off for you. Okay. Now just ask you to follow this pen, just with both eyes. Just follow the end of it. That's it. Okay, I'm just going to check your pupils. So look directly at me, look into my eyes. See a light to the left, but just look towards me. Okay, I'll check the other one. Excellent. Okay. Alright, and I'll just check your blood sugar levels as well. So do you mind if I give you a small prick on the finger to see what you... Okay. Machine. Okay. So now I'll just get some further details from the patient. It could be on the way to the hospital, but first I'll just do the fast test, which is for the stroke, as she said she had weakness down her left side. So, okay, Tara, can you lift your arms up for me, both arms up towards shoulder height? Okay, alright, and can you just grab my 3 fingers in each hand and give them a tight squeeze? Okay, so there's weakness in the left hand there. Okay, Tara, with your toes, can you just pull your toes up towards you? That's it. Okay, and push them down. Okay, alright, so there's still some weakness on the left hand side there. Okay, and there's also some slight slurring in her speech, so that would indicate to me that a stroke has occurred, and that it's happened 20 minutes ago. It's fairly time critical that we get to the hospital within 4 hours of the symptoms presenting. And like I said before, some of these details we can get on the way to hospital, but I'll just run through them now, some of the questions that I would ask. Date of birth, Tara? Labour. Okay, and were you born in Australia? Or? Yes. Okay. Are you working at the moment?
Yes.
Okay, where do you work?
Work in hospital.
Okay, excellent. Alright, and who called for an ambulance?
Me.
You did? Alright. Yeah, you said you didn't have any pain. Is that still the case?
No pain.
No pain at all? Okay. Right, now, have you got any other illness at the moment, any conditions?
No.
Right, are you on any medication?
No.
Right, do you take any, do you have any allergies?
No.
No. Okay, and do you smoke at all? Do you drink any alcohol?
No.
Very healthy.
Yes.
And any other drugs, recreational drugs?
No.
Anything else? No. Okay. Now, do you aware of any history of any heart conditions?
No.
No. Okay. Any fainting that you've had?
Only to do with low blood sugar, but not recently.
No. How long ago was that?
About 4 years.
4 years ago. Okay. Alright. Do you have any trouble sleeping?
No.
Sleep. Okay. And what about headaches? Do you have any often regular headaches? No. Okay. Do you have any history of seizures or epilepsy?
No.
Okay. And when was your last meal?
2 hours ago.
2 hours ago. And what did you have?
I had lunch, a salad.
Salad? Okay. Alright. Do you remember the last time that you vomited?
No.
Not recently?
Not recently.
Which is good. Alright. Do you have any also any heart history? Any problems with your heart?
Not my heart, no.
No. Okay. Someone in this family?
I think my grandfather had a valve issue, but
Okay. Alright. Nothing recently. Okay, so while I've been doing the interview, my partner has been completing a Rosier scale form, which is the recognition of stroke in emergency room. And then we'll be on our way to the hospital, one that participates in the stroke code notification. As stroke is a time critical condition, you have to get to the hospital within the 4 hours of the symptoms presenting. And like I said, any further questions or in-depth interview can be done in the back of the ambulance. And the questions that I've asked have covered some of the differential diagnoses, such as acute coronary syndrome, alcohol, substance abuse, Bell's palsy, benign positional vertigo, brain tumour, delirium, dementia, head injuries, migraine headaches, myocardial infarction, seizure disorder, subdural hematoma, syncope, and transient ischemic attack, which is the mini stroke. And at the hospital they may do blood tests, some scans, CT, MRI, and blood flow tests where they inject the dye and see where the blood is going or not going. So pretty confident that those sort of symptoms that Taro expressed to me would show that she's had a stroke, and we need to get to the hospital. Okay, thank you.